Hey, deserving listeners, 90 Day Fiancé. Let's see what happens.
I don't deserve what you just said. I ain't said talk to me. That was Marley. No, bitch. Okay. That was Marley and Kelly. So why don't you walk your brave ass and tell them that? And see what Molly tell you. Don't ever talk to me like that again.
Angie.
No, go to...
The only one who's mad right now is you.
No, bitch, you run your
Yeah, I like that. I forgot about that. That's just, I wouldn't have known what to say, but that's a really, Angie, the only one as mad as you. I don't know what to tell you.
And I'm not it.
I'm not running my mouth.
I'm not it. When did I...
She thinks this is okay. Her very terrible excuse is that, well, Michael cheated on me and I worked in a prison. What?
Body language of what she was saying that was
triggering.
triggering.
It made me go in defense. Like, I worked at the prison. So that's something that I always take with me everywhere too. I can't help that. And maybe that's my problem.
That's a beautiful thing about your...
Okay, so she kind of got there eventually. Maybe that's my problem. That's something. Now, I'm guessing a lot of the audience would hope that this therapist would blast her, say, you're wrong and you're abusive and, we're gonna kick you off the show. I'm sure that is not the therapist's goal or mindset or task. So we're not likely to see that. And we might even see the therapist reaching out and empathizing, because you got to start somewhere. And in your head, you might be thinking as a therapist, oof, that was abusive. We got to stop that shit. But I'm not going to get anywhere with her today regarding that. So I've got to establish some beachhead, and then I can start to invade from there.
Personality, Angela, is that you do stand up and you are very protective.
And that's great, because she is reframing it as a positive, which it probably is. Sometimes it's probably how she sees herself, and she might have absolutely been justified doing these kinds of things when she was 5, 10, 15 years old. So it's good to kind of start from that place.
Sometimes our most beautiful qualities, there's two sides of the coin, right? There's another side of the coin, and sometimes it comes from a pain point.
Yeah, that therapist has a way with words. It's very good.
I don't have the comfort everybody has. I don't have no one to help me stop when I get upset.
And then it's all back to Michael. I mean, she didn't directly blame Michael, but at least I was like, you don't have anyone? What do you mean? Who are you? Like a therapist? It's Michael. She's like, if Michael were here, so if Michael were there, you're saying that you would have listened to Michael if Michael would have said, don't do that or calm down. You would have listened to him? Not a fucking chance.
Love it. So when we know with anger, it's a secondary emotion. And as we're talking about earlier, there's something that...
Okay, so she's using language that I use. I mean, I don't use those phrases, but the concept, although it could mean a few things, but I'm guessing it means what I think it means to her. In my world, it's usually considered a part of emotion-focused therapy, but there's also just a lot of emotion theory in our field that will have this concept in it. I will use the language that we will convert our fear and our hurt into anger, or we will mask our hurt and our fear with anger. But the tagline in a lot of literature is that it's a secondary emotion, meaning you have a primary emotion, which is hurt or fear, and so you start with that emotion and then you get angry. So that's what she's referring to, which is a good place to start. But she would have to explain that to Angela, which, it's kind of interesting to think about. So this is therapy. This is, arguably what was happening before with the group stuff. It's like therapy-esque or therapy-ish. Yeah, and it takes time for these kind of things to grow. But, this is actually like a therapy session. So it's like, and this therapist is doing, I think, a really good job. So it's like, I'm often thinking, if I or someone just had the ability to start the ball rolling with Angela. Where could we get? And so it's happening.
Talking about earlier, there's something that triggers us to have an angry response, and we talked about.
Okay, so she's referring to, as we talked about earlier, we see only the edit. So what I'm hearing is they already went over this with all of the cast members, which is great, and maybe that'll help Angela to start seeing some things right now.
Are saying to you what they're trying to project onto you. So one of the things I would like for us to work on during this retreat is anger. And do you agree that that's something that we can work on?
But then the ending, that wasn't super graceful. I get it, but and there it could be some pressure from the producers, but that was kind of, especially with Angela, and maybe Angela will say yes, but do we really think that Angela will say like, yeah, I have a problem? She laid some ground, and I've done this many times before too. As a therapist, I will go too quickly, and it's a classic novice therapist thing. She's not a novice from my understanding, but when I'm supervising people, they will do this too, where they leap forward too quickly. For the therapists out there, I just want to review what happened there and comment.
The things I would like for us to work on during this retreat is anger. And do you agree that that's something that we can work on?
At least in the edit, there hasn't been any established statement or sentiment from Angela that she even has a problem with anger, and certainly that she wants to work on it, right? So even if Angela agrees to this, given her personality, I would guess she wouldn't actually be on board. And that is a key part of treatment, especially on something like this. Angela has to, a large portion of her selfhood has to be recognizing that she has a problem and that she needs help for it and that she wants help from you. And those are three things that are hard to convince someone, like Angela particularly. Abusive people are really hard to convince. That's why they often end up in mandated treatment. And even then, it would take me months of really confrontational stuff and also a lot of compassion to get them to recognize even that they had a problem. So those three things, Angela 51% of her has to say, I have a problem with anger, and I need help. I can't do this on my own. And you are the one to help me with that. Those three things, until that happens, you can't move forward. And so what the therapist did is sort of leapfrogged that by saying, and the therapist even said, I would like you to work on anger. What do you think? And that puts Angela in this position where if she's far from even admitting that she has a problem with anger, then at best she'll placate, and at worst she'll be like, what are you talking about? So let's rewind that again. This is for therapists and really any profession. Well, even parenting can be this way too. When you're working with your kids or a teacher in school, when you have to spend some time, and it can be frustrating, helping the individual to see that they have a problem that they need to work on. It's not automatic. We call this the stages of change. There's, pre-contemplative and contemplative, meaning that for Angela, well, let's go through this. There's a number of different models of stages of change, but I'll select the simplest one. So you have a pre-contemplative, meaning that it's a nice way of saying that you don't think you have a problem, even though you do. In some, that's a simplification, but then you have contemplative, meaning that you think, maybe I do have a problem, and maybe I do need to work on it, or I think I have a problem, but I'm not ready to work on it, or I definitely have a problem, but I'm too afraid to work on it, or something. It's in that zone. Then there's action phase. So you have pre-contemplative, contemplative, then you have action, where you're actually taking action. You're actually you recognize you have a problem and you're actually working on it. And then you have maintenance after that, because after you've worked really hard on the problem and you've established a lot of success, then there's the maintenance phase where you're continuing to maintain the change that you have established. So, and there's a lot of different venues in which this will be used. It can be used in therapy, it can be used in drug treatment, it can be used in a lot of other situations. But so for Angela, I would guess she is firmly in the pre-contemplative phase, meaning that she doesn't think she has a problem. Maybe there's a little bit of a question there, but she's definitely not in the phase where she thinks she has a problem and she knows that she needs help. The action phase, so it's important to recognize this if you're ever in these shoes as a parent, as a teacher, as a therapist, because we want people to be in the action phase, right? We want Angela to recognize she has a problem and to work on it. But unless you can assess and fully appreciate the stages of change, you will bulldoze and you'll lose the client, or you'll put them in a position where they placate and they're not really ready to change, right? And there's a lot of other negative effects that can happen from that. And it's weird, in counseling training and therapist training, stage of change, it's not necessarily ever taught because the professors, the trainers don't know to talk about it. It's not like one of those fundamental topics that we talk about. And I think even stages of change comes from the drug and alcohol worlds, and counseling and therapy circles, psychology, psychiatry traditionally considers themselves very separate from drug and alcohol. And so if they ever hear anything from them, they're like, it's drug and alcohol. And a lot of people look down in my profession on those folks, even though that's silly. But I don't know. I only vaguely remember the history of this concept. But anyway, so if you're pushing them to be in action and they're pre-contemplative, then you're just spinning your wheels. And it's very frustrating to you as a clinician, because you might even get them to placate you, and it's like, how come you're not doing anything? But the problem isn't the problem yet. The problem is they don't know they have a problem. And that's the first problem you have to work on. And that would require a lot of time with Angela. I wouldn't be surprised if she stayed pre-contemplative about her anger problem, or whatever label you want to put to it. I wouldn't be surprised if she stayed, like if she came into my office or someone like her, I wouldn't be surprised if she, and I had, all guns ablazing, trying to do everything I could on this one topic. I wouldn't be surprised if she was pre-contemplative for 2 or 3 years. Maybe shorter, maybe 6 months, but a long time. Certainly not like one day of weird or of icebreakers. But it sounds like we're hearing about other interactions that they've had, which is encouraging. But anyway, maybe I'm selling Angela short. Let's see what she says.
So one of the things I would like for us to work on during this retreat is anger. And do you agree?
Now, before we go to Angela's response, there would be absolutely nothing wrong, particularly given the scenario, for the clinician to say, I need to establish some ground rules about how we treat each other on this retreat. For everyone's safety. And I would like us to talk about how you are going to manage your anger. So that would be okay. But you're stating this is my agenda. I'm not acting like you're at action when you're pre-contemplative. This is just the reality of the situation. I'm drawing a boundary given my place of authority and given my responsibility to everyone, including this. You could say something like that.
That's something that we can work on?
If it makes you happy to work on it with me, yeah.
So you hear, that's placating. That's not, I have a problem with anger. It's, well, if it makes you happy. And I think she's smiling because she's like, well, that's not the answer I was hoping for. And it's quite possible that these therapists have no idea how bad Angela's behavior is. And they just think, well, let's just have a conversation. She'll be reasonable. So maybe she's now realizing, what? Like, given everything that happened, you don't think you have a problem? And you're only going to work on your anger because you're trying to please me? Like, wow, that's a level of lack of awareness that I did not expect. So, yeah. That's exactly what I'm talking about. If you're pre-contemplative and you push too far, you're going to get a placating client that, and I don't think, well, we'll see. We'll see what happens.
Today's session with Dr. James.
So, sorry for going down therapy talk, but it is very, very important that clients come to therapy with what they want to work on. And if they don't know what they want to work on, or you believe as a clinician that they should probably be working on something that they don't recognize that they should be working on, it is imperative that the client come to the conclusion. Now, you can say to the client, and this is my style, I would say, well, I'm just your therapist and I'm not you, and I don't know your full situation, but from my standpoint, given what I have heard, I think you have a problem with anger, but I'm not quite so sure about that because I don't know you. You know yourself 1,000 times better than I do, but the things that I've heard, it sounds like there's a problem there, and I'm recommending that you work on it, but you are under no obligation to do so, and maybe I'm wrong. So I say stuff like that all the time. So I can say that, and that's just my style. I just kind of level with people while also saying, what do I know? Because I literally believe that. I literally know that I don't know because I don't know. So I'm throwing it out there. And as a client, I would want to hear that from a therapist. That's just what I want. Not everyone wants to hear that. And not every therapist is that style. But the key is that the client has to ask. They have to say, I want this. I have a problem and I want this. And until they say, I have a problem, I have this problem, and I want you to help me with this, until the client says either that or something very definitively within that camp, and also repeatedly says it, maybe even throughout sessions or over time. Now, I will say that for some clients, and maybe it'll work with Angela, that you just sort of forge ahead and then they sort of see the light as you're forging ahead. But that's not what I recommend. And of course, if I were to recommend a treatment protocol for Angela, it wouldn't include this group retreat, or it wouldn't exclude it. But what it would include is talking with a specialist once or twice a week for a number of years while they comb through all this sort of stuff together. It's just, I think I just have to temper my expectations about this 2-week retreat thing. All right, let's adjourn there. And I want to remind everyone to take care of themselves because you deserve it. You really, really do.